Y'all, thank you for coming. We are happy to have Holly May signing today, assisted by Josie McDaniel Barquette. Chaplain Denny, if you please.
Get our weight loss program.
There's a quote that says, "The things we take for granted, someone else is praying for." If you would, with that spirit, if you're a praying person, please pray with me. Oh God, in a season of concern and uncertainty, help us to remember, for everyone upset that can't take their boat on the lake, there's someone praying for fresh water. For everyone frustrated, they can't congregate with their friends, there's a lonely person praying to have a friend and be accepted for who they are. For everyone disappointed that their favorite restaurant is closed, there's a malnourished person praying for something to eat. For everyone discouraged that they have to watch their religious service online, there's a person praying for the opportunity to freely worship. For everyone frazzled about having their children do schooling via the internet, there's a person praying for the chance to learn how to read. God, we are abundantly blessed by you, and for that we give you thanks, and help us to remember that in all things. Amen.
Thank you. Ladies and gentlemen, thank you again for joining us. We will, of course, continue having these briefings indefinitely to keep the citizens of South Carolina and everyone interested and concerned fully informed. I have issued a new executive order today. One closes non-essential businesses in our state. We issued one last week that did that on some non-essential businesses, and now we've issued another to expand that. And this includes, this is starting Monday at 5 p.m., furniture stores, jewelry stores, department stores, clothing stores, shoe stores, clothing and shoe accessory stores, florists, sporting goods stores, book, craft, and music stores, luggage and leather goods stores, and home furnishing stores. Such things as hardware stores, these are not included. Hardware stores, firearm retailers, and home improvement stores are not included in this order, and all that will be made clear in the written order when it will be issued. But again, that will go into effect Monday evening at 5 o'clock p.m. Also, I have issued another order that goes into effect right now. And that is about short-term rentals in our state. I'm hereby suspending short-term rentals to persons from CDC, that's the Centers for Disease Control, identified places, hotspots, states, from coming into the state beginning right now, rentals starting right now, no new rentals of those places starting right now indefinitely. And that includes hotels, short-term rentals, motels, vacation homes, condominiums, resorts, bed and breakfast companies, timeshare companies, but this specifically excludes people from any place that are military, medical, first responders, or commercial transport. So those are the two executive orders. Those are new. As you know, we are taking a deliberate, steady, planned approach. We believe this is the best way. It's based on the science, based on the facts, based on the advice of the professionals, and we will go as far as we need to or as advised to keep the people of this state safe. And with that, Dr. Bell.
Thank you, Governor, and good afternoon. We have now received reports of documented cases of COVID-19 in every county across our state. This includes 147 new cases as of today, which brings the total number of people confirmed to have COVID-19 in South Carolina to 1,700 cases. We are at the point where we are reminded daily of how serious this situation is and the obligation we all have to help prevent the loss of additional South Carolinians. Know that we are all in this together. and at some point many of us will likely be exposed to the virus. And the level in which the virus continues to spread will rely on all of our actions. We want to reassure the public that so many of us are working hard together as a team from the local to the state level and with national partners to protect the health and safety of all South Carolinians. As of today, we continue to work with healthcare facilities to stay updated on the availability of acute care beds throughout our state, and currently we are at 52% capacity. We are working with our emergency responders on an electronic system that will allow them to determine if they are responding to a house where there has been a recent COVID-19 patient. This will give our first responders additional information to protect themselves appropriately. And we have provided a third round of PPE shipments to the counties from the Strategic National Stockpile. We know that this is a challenging time, and what we're calling on everyone to do is not easy. We encourage all South Carolinians to take actions to protect themselves and those they love. Nearly every day we learn of a new case that is the result of an unexpected exposure or an unknown source. And what our current data shows is that social distancing and staying home helps combat the spread of this disease and ultimately saves lives. And so this must absolutely continue everywhere until we see a significant decline in these cases that is sustained. We are always mindful that each new case represents a real person. We anticipate releasing counts of confirmed and estimated COVID-19 cases by zip code later tonight. We will provide estimated cases at a later time, but those will represent those who are likely undiagnosed or untested. And by including estimates, we hope to better convey more meaningful information about the real risk of disease spread in our communities. We ask for your continued cooperation with following the guidance of public health professionals so that we can continue to fight on every individual's behalf. I ask everyone to please do your part, to stay home and limit your close contact with others so that we can slow the spread of COVID-19 infections. And as always, for the latest information, please visit our webpage at scdhec.gov/COVID-19. Thank you.
Thank you. Mr. Davidson.
Thank you, sir. Thank you, Governor. My name is Nick Davidson, and I'm the Acting Public Health Director at DHEC. We've produced a couple products recently, and we thought it was wise to show you one of those products. We'll be making that available on our website, and we'll be showing it here on the screen momentarily. The video or the animation loop that we're providing to you is an attempt to make it clear about the cases as they spread around the state. You can see in the video here that it starts in early March, and the cases begin to grow throughout the state. And as they progress towards 1700, you can see the heat map is showing that progression to the current date. So this will be available on our website, and we always try to do what we can to express the risk that people face if they don't take some of the precautions that we advise against. And so the opportunity here to see the spread, we hope will be a sobering reminder of the need to take precautions as people go about their lives throughout the day. So that will be available on our website this evening. I also wanted to talk about our efforts in our laboratory. We continue to be very proud of the work that our laboratory staff and officials are doing. We are working through extended hours. We're working 7 days a week to do the testing that we need to get done in the state. We're using even extended hours during those 7 days, and we run samples throughout the night as well when necessary. So we have not recently had a backlog. We currently do not have a backlog. We are currently working through a challenge where we probably have enough materials, enough reagents in the laboratory to test the rest of the specimens today, and then some of the specimens that we'll receive tomorrow. But if we don't receive additional specimens, we do anticipate going into a bit of a backlog scenario. So we're working with our partners here in emergency management, with the governor's office, and with our federal partners as well, and the suppliers to try to make sure that we can continue testing. The last thing we want to do is have a delay, but I also want to be very honest and transparent with you that we are potentially facing a delay over the next day and a half or so. We'll certainly let you know as that changes, and we certainly hope that we get some supplies in, but we don't have any scheduled for delivery. So we're doing everything we can to make sure that we don't have any backlog. Thank you.
Thank you.
Hello, my name is Jennifer Butler. I'm with the South Carolina Department of Mental Health. And as we've been talking about making sure we're caring for our physical health, we wanted to make sure that we drew attention to paying attention and care to our mental health. The Department of Mental Health is open, fully operational and functional across all of our inpatient facilities and our community mental health centers. This is a tough time for everyone. Certainly our patients who already struggle with anxiety, depression, isolation may have an exacerbation of symptoms. But those of us who may have not previously struggled with any of those symptoms may find ourselves now feeling anxious, feeling concerned and worried or uneasy. The Department of Mental Health and many other resources that they'll list on the screen are here to support you during this time. As we stay at home to save lives, we still need to stay connected. So if you are feeling suicidal, we urge you to call the National Suicide Prevention Hotline at 1-800-273-TALK. We also have the crisis text line, which is, both of those lines are answered 24 hours a day by trained counselors. You text the word HOME, H-O-M-E, to 741-741. The Department of Mental Health also provides South Carolina with a unique opportunity to respond to the mental health concerns during this time because of our statewide system. We have clinics in all 46 counties of our state. We are also able to roll out a community crisis response and intervention team, essentially a mobile crisis that is available 24 hours a day, 7 days a week. The number you see here for the 1833 DMH-CCRI, that is for that crisis mobile number. Call that if you need to reach out. Regardless of whether or not you're a patient, any South Carolinian will be served. We also have resources and information about our clinics at scdmh.net. Again, please stay connected during this time. It's important that we not lose sight of each other, even though we may be physically a little bit further apart. Thank you, Governor.
Thank you, ma'am. Ms. Stinson?
Good afternoon, Kim Stinson from State Emergency Management. I'm going to give you an update on where we're at in terms of obtaining personal protective equipment, and that's the equipment that's worn by medical health professionals and also by our first responders to minimize the exposure to hazards. And this first slide summarizes the requests and current status. The top line kind of outlines in terms of what the categories are, those 5 general categories that we're tracking right now. The second line discusses the number that have been requested in our system here through emergency management. The next line is what's been either ordered or in some cases donated. And then the last line there is what's been delivered so far. And just as an example, on the N95 masks on the left-hand side, is that we've requested over 300,000 of them we've been requested to provide 312,000 of them. And then we've ordered almost 1.7 million of those masks through various sources. And then so far, we've had a relatively small delivery of 82,000. So all those same way across the board there, surgical masks, eyewear, eye and face protection, and the gloves and the gowns give those requested what we've ordered and what's been delivered so far. You will see that in a lot of cases we haven't gotten a lot of deliveries. This is a worldwide really issue beyond just our nation, and of course every state and every local authority is trying to obtain this equipment during this time. So the next slide is basically the strategic national stockpile that Dr. Bell and Director Davidson talked about, and basically outlines what we've received and distributed, those shipments in the last shipment that we received this week, and I believe all of them were made today. And now they're down at the local level, so that the local authorities can further distribute them throughout their counties. So this, again, the 5 categories, and there's over 300,000 distributed in the N95 masks, over 200,000 of the surgical masks, 97,000 of the eye and face protection, and over 400,000 gloves, and over 400,000 gowns. And then the last section at the bottom of the slide there basically is a representation of selected county distribution using those 5 major categories. And then the last item, I've got the ventilators, and this is a pretty simple chart here. Far left, it shows the ventilators that we have here in South Carolina. The next column shows the ventilators that are currently in use. Currently, we have 87 requests in our system from some local authorities, but we have requested over 700 from FEMA, and currently have not received any of those. And, sir, that completes my update.
Thank you. Well, as you can see, there's been a lot of work done. We have a very serious situation, but we are taking a deliberate approach. We're implementing our plan, which is influenced, of course, by new facts and information coming into us. But again, we want to urge everyone to stay home, stay home. We've emphasized that. Things are safer at home than anywhere else. We also want to point out that despite our deliberate approach, when there's non-compliance with what we have asked, then we can begin mandating things. And that is why we're having this expansion today on these businesses that had not been ordered before. We need to see to it that we are carefully being as aggressive as we can, and that is why we're taking those steps today. Are there any questions? Yes, sir.
Governor, is there going to be a third and a fourth wave of non-essential businesses closing? And
I beg you, say it again.
will there be like a third and fourth wave of non-essential businesses closing?
That depends on, as I say, the facts, the rate of compliance, the advice, and the science and data from the professionals, many of whom you see here and those they represent. Yes,
and
sir.
why wait till 5 o'clock Monday?
Beg your pardon?
Why wait till 5 o'clock Monday? Why not do this right now?
It takes some time to get things done. With the reservations, that is immediate. That goes into effect right now. My oral statement constitutes the order for right now, and it'll be published very, very soon. But the other one for the businesses takes place 5 o'clock Monday afternoon. Yes, sir.
You mentioned compliance within the state and people adhering to that request to stay at home. For example, this weekend, the Orangeburg Flea Market plans to be operational and functioning. And lakes, people are still going out on boats. Why not take the next step and just issue the stay-at-home order when there are still 10 states?
Right.
You're one of 10 not to do it.
We've already issued orders mandatory that address both of the things you just mentioned. The law enforcement has the authority during a period of emergency to disperse crowds like that. There are criminal penalties if it's up to the discretion of law enforcement. As you know, it goes in South Carolina, our statute goes down to as few as 3 people that are causing a problem in health or otherwise. And as far as the lakes, we've issued an order that's mandatory on that, and all of those people are subject to penalties. Yes. Yes, ma'am.
Governor, what would make you issue, or what would change that you would actually issue a shelter-in-place order?
As we are trying to, the measures that we have taken, both voluntary and mandatory, contemplate staying at home. We are taking a deliberate approach. Our state is not like everyone else's state. Georgia, for example, has Atlanta. There are more people in Atlanta than there are in South Carolina. New Orleans, the city of New Orleans has become a hot spot almost in a very short period of time. South Carolina is certainly not New York. Every state is different, is different. They have different economies, they have different resources, they have different medical facilities, but we are taking a deliberate approach to be as aggressive as we possibly can at the right time. And we're following the data and the science to do that. Yes, ma'am.
Governor, you've said that you're making a lot of these decisions based on the advice of medical professionals who are watching all these developments very closely. Several days ago, one of those professionals, Dr. Bell, told me that she felt that focusing on zip code level information on cases was a distraction. This morning, you directed DHEC to begin releasing that information. How did you come to that decision?
Well, I'll let Dr. Bell explain that, but as she will tell you, we believe that it is important information for the people. We want the people to know what we are facing. But it does, in some quarters, could lead to a false sense of security, and I'll ask Dr. Bell to address that, please.
So we believe that the information provided with disease occurrence very specifically can be deceiving, giving people a false sense of security, and we don't want them, or we don't want anyone to believe that, as you've seen this heat map, that will progress. And so if anyone believes that their neighborhood is not going to be affected based on what they currently know or what is being reported from a very specific location, we don't want that to lead to any misinformation, or that what we have always recommended should not continue. So that regardless of that information, the recommendations that have been made, we strongly urge people to follow. The other part of that is that the zip code information alone only represents people who have actually been tested. And we know that with inadequate testing supplies and with inadequate access to care, not everyone who is sick has been tested. And so we don't want anyone to believe that that information in any way says what is actually occurring in the communities and the risk for disease spread, regardless of the case counts.
But what about the opposite of that? If there is a known zip code or several zip codes close together where there are a lot of cases all of a sudden, wouldn't that be good information for medical experts like yourself to think, well, maybe something in that area is happening specifically that we should take a look at?
Well, and that's good information for the health department to respond to. But it should not change the behaviors of individuals in the community. It's important for us to have that kind of information because that's where we implement our disease prevention and control measures. We conduct contact investigations. So that kind of information is not for the general public to act on in terms of responding to information about an outbreak. And so the difference is that we use that information monitoring the occurrence of illness to take specific and different actions, whereas individuals in the community are expected to do the same thing regardless of the number of reported cases, because there will continue to be unexpected exposures. And if they rely on that information to make decisions about which neighborhood is safe or is not, they're making a mistake.
Yes,
Governor,
sir.
can I ask about the legality of your hotels, short-term rentals order? The U.S. Supreme Court has held that the Constitution grants all residents of every state the right to travel freely between other states and the right to be treated equally as citizens from any other state in those states. So have you thought about the legal repercussions of that? Have you talked to the Attorney General about that? How do you square that with the Supreme Court's
Yes,
precedent
we
on
have studied
constitutional?
that question. That's a good question, and we are well within the constitutional and legal limits. Those things must be precise, must be not more broad than necessary to reach the necessary goal, the health goal, and that order does square with all legal principles and the Constitution. Yes, ma'am.
I have a question for Dr. Bell. Experts say that the virus can now spread through breathing. So do you have any, new advice for the public on how to prevent the virus?
I'm sorry, that it can be spread through breathing?
Yes.
So I guess you mean as opposed to coughing, just regular breathing. Well, researchers are continuing to learn more and more about the characteristics of this virus, including how it can be transmitted. And there is new information that has identified that individuals have spread infection prior to the development of symptoms, things like a cough illness. And so there is that risk, and for that reason, the CDC has updated guidelines by defining a contact. We previously said that we define a contact of someone who's had face-to-face contact with someone from the onset of their symptoms, and we've actually moved that back to face-to-face contact with known cases for 48 hours prior to the development of symptoms. And so that is in recognition of the possibility of spread by people who are asymptomatic, and also therefore additionally raises the risk of unrecognized exposure and the importance of social distancing.
And one more question, with the, I guess, shortage of thermometers, being able to get them in stores and online, is there any other way you can, I guess, check your temperature or check symptoms at home?
Well, without a thermometer to measure, we do go by what we call a subjective fever. If you feel like you've had a fever, if you feel abnormal, and so without a thermometer, that would be all we'd have to go on.
Dr. Bell, how is DHEC projecting the COVID cases by zip code?
I'm sorry,
How is DHEC going to project the potential COVID cases by zip code?
So there are a number of models that we can use to give estimates. One means is that we understand from the proportion of tests that we have run, the proportion of those that are positive. If we use an estimate in an area that assumes that for individuals who haven't been tested, we apply that proportion of positives to that estimate, proportion of the population. That's one way to make an estimate. And there are other ways based on studies that have been done in other parts of the world, and we're working on those estimates.
And does DHEC plan to release demographic data by county?
No, we're already releasing demographic data by county. We are providing aggregate reports of the proportion by sex and by age group by county.
Okay. Governor?
Yes, sir.
We've heard issues with the unemployment office addressing calls. As of 1:30 today, the call center was down. You could not get to them. How will this be impacting people filing for unemployment if there's a backlog or if the system is failing? And should people be reasonably concerned that they might be without benefits if they can't reach the unemployment
It's
office?
not the South Carolina system that's failing. It is the mainframe computer at the Social Security Administration. And we've had contact with them there to address that situation. Danny Elsie, Director of Department of Employment and Workforce, has had contact as well. What has happened to file for unemployment, the Social Security number of the applicant must be verified. And the mainframe computer at the Social Security Administration is being overloaded. Our system here in the state can handle it. Other states are having the same problem. I'm confident they're doing all they can in Washington, but we're working on that. But eventually those numbers will go through. Everyone can be assured that even if it's retroactively, they will receive the employment benefits that they're entitled to.
So, Governor, just to clarify, I said you did mention it will eventually go through. Will they receive a back pay for this time?
That is correct. They will receive the things that they are supposed to receive retroactively. That is correct.
Governor,
Yes,
when you saw those unemployment claim numbers, when you see the recent data, across the country, what are your thoughts? What's your message to South Carolinians who are struggling right now when you see these numbers?
To every South Carolinian, their own job is an essential job, and there's no doubt about that. And it is one of the regrettable parts of this virus is that the response is so heavy on all of our citizens. But I can assure you that this Team South Carolina, in all of its capacities, is exploring every avenue that we can to do two things: to keep the people safe, and then to repair the damage that has been done by the virus and the actions taken to combat that virus.
Governor, the governor of Alabama just moments ago issued an official stay-at-home order for all the residents in that state. That makes us the only state in this whole region without one. Again, coming back to that question, what could it be that would make you change your mind about issuing such an official order like all your colleagues are doing?
Well, again, South Carolina is unique. Our people are unique, our structure is unique, the industries, the businesses, every state is not like every other state. We are doing what we believe to be the most aggressive thing that we can do to combat this virus. When it becomes time, if it becomes time to issue such an order or any other order that we have not yet issued, I can assure you we will issue it.
Governor,
Yes,
have you given any further consideration to the June 9th primary elections? We've been hearing from a lot of voters and candidates who are worried that the state is not going to be back to normal by then and want some heads up, some advance warning about whether or not the election will be delayed.
As of this time, they will not be delayed. But again, as I say, everything is on the table. I'm confident that arrangements are being made for absentee voting and those sorts of things, and to where people can receive whatever materials they need without congregating and those kind of things. But those are decisions that we make deliberately and carefully to be as aggressive as we can in combating this virus without going too far and doing damage that is unnecessary.
Governor.
Yes, sir.
The South Carolina Nurses Association sent you a letter about the concerns they have about working conditions, lack of adequate PPE, lack of access to testing, and them being short-staffed. Have you responded to them? What has the response been?
Everything that, I don't know if we have had an official response by mail, by letter, but our response has been stated from this podium, and it was just most recently stated by Mr. Stinson. When you saw the lack of supplies, you saw what we've asked for, and you saw what we've gotten, and we understand it, we agree with it. This is a rough situation, and we know that it's going to get rougher. And that's why we are urging people to listen to the professionals in our state. Stay at home, for goodness sake, stay at home. If you don't have to be out, stay at home and be a good neighbor. Remind other people about the social distancing and the other things that are required. Yes, ma'am.
One last question. As far as the backlog of testing, why is it still taking 7 days for people who've had the testing to get their results back?
It is the case that it was last week, end of last week and into the weekend, where we were making up a backlog. We had approximately a 2-day backlog at that point in time. Probably the predominant cases that you're speaking of are probably the private labs. We understand that they're suffering much of the same, if not worse, of the shortages of the materials that are required for testing. And so we've heard numbers anywhere between as 3 and as many as 11 days of a backlog. So we're working in our lab. If we do encounter a backlog, we need to make sure to prioritize first responders and prioritize inpatient hospital admissions. And so we're going to make sure if we do run into a backlog that we get those that are most critical tested fast. We hope we can get everybody tested fast, but I'm confident most of the cases that we must be talking, or that you must be referencing, are the private ones that have been submitted to private labs.
How, if I could just follow up on that, how are the state's testing supplies now? What is the sort of status of that?
Within South Carolina, you mean? Yes. So we have enough to test today, and probably, depending upon the numbers we receive tomorrow, half or most of those that we receive tomorrow based on our current supplies. We've only been running maybe 1 or 2 days worth of supplies, and each day we would consume some, and then every couple days or so we would get a small amount of supplies. We're not used to running it anywhere near that close. We understand that all other state public, well, most other, if not all other state public health labs are experiencing the very same thing. And so we're doing everything we can to try to ensure that, one, we don't have a backlog and we can test everybody the moment we get them. We're also looking at trying to increase our capacity as well, so that we could take on even more testing, assuming that we have the reagents to do that testing. Right now, the reagents are the limiting factor.
Governor?
Yes, ma'am.
You mentioned this South Carolina isn't like other states with some cases with Atlanta having a hotspot right now. How do we prevent from getting to that point without more mandating people staying home?
We hope to keep from getting to that point by following the advice and recommendations and best practices that have been distributed in every fashion to our people, as recommended by the professionals that are here today.
To piggyback on that question, Governor, you talked about South Carolina being unique, as all states are unique in some way. What is it specifically about this place that makes us unique in a way that we are an outlier in not having that stay-at-home order that every other state in our area does at this point?
Well, we have some orders other states don't have. We have issued a lot of orders, a state of emergency. We've closed the schools. We've got criminal penalties for mass gatherings. We've closed the restaurants and bars. We've closed non-essential businesses, some more today. We've had employees to work from home. We've urged those in private business to work from home. Many of them are doing that. Our state employees of about 50,000, most of them are working from home. We've restricted access to nursing homes. We did that way at the beginning. Only those people coming in for end-of-life situations would be allowed in. We've restricted the prison visitation. We've activated the National Guard. We've suspended elective surgeries at all of the hospitals. We've issued travel restrictions. We've mandated regulatory relief. We've postponed local elections, but not the other elections. We've activated the criminal price gouging law. There are many other kinds of orders that we can issue. We issued 2 more today. And if necessary, we will issue whatever order that we are confident will make a difference and keep the people of South Carolina safe.
But doesn't it seem to be a stair-step approach? I mean, why not just go ahead? It seems like you're saying that ultimately that very well could be where we end up. Why not go ahead and do it?
It could be where we end up. There are many other orders we may issue as well. I believe that we are taking the precise, deliberate approach according to our plan to keep the people safe.
But what are the exact characteristics that make South Carolina different than every other state in the Southeast that are keeping you from issuing that order?
Well, every state is unique. As I mentioned, Atlanta is in Georgia. That's
what is it about South Carolina?
I beg your pardon?
But what is it about South Carolina?
Well, we don't have an Atlanta in the middle of our state as Georgia does. That's a highly dense urban area. The same for New York City. We have tourism industries, others don't. We have a manufacturing industry, others don't. We have many different components of our people are different. Even our geography is different. We have different professionals. We have many strengths in our professionals that others do not share. And one of them is in the mental health area, which South Carolina is, I believe, virtually unique in what we have to offer there. So I say again, we take a deliberate approach based on the advice, recommendations that we get from the professionals, the data, the science, advice of the professionals in our state, whom we know, whom we rely on, and whom we trust. And when it is time to issue any order, that is when we issue those orders. Yes, sir.
Dr. Fauci from the NIH has said every state should have shelter in place. What information, I guess, how are you weighing his expertise against the expertise in the state?
If you will look at the orders that we issued, both those that advise as well as those that mandate, we have urged people to stay home from the very beginning. We had it on the highway signs. We've had it on an emergency alert a few days ago at 6:30. You might have gotten it on your telephone. I don't know how many more ways it's necessary to say that at this point. But again, what we are taking is a comprehensive approach based on the data, based on the recommendations, advice, and understanding of the team here in South Carolina, many of whom the professionals representing those that you have seen in these briefings that we've had. Yes, sir. No question? Yes, sir.
The legislature's obviously coming back next week. The Speaker and the Senate President called them back, and quite a few lawmakers are concerned about that. Some are telling us they're not going to go because they think it's more responsible to stay home. There are some who have asked you, they've noted that the state constitution gives you the ability to select a different location if there's a spread of a contagious disease. Is that something you would consider? They've asked for somewhere like Colonial Life or the Koger Center, where they could space out more as opposed to the House and the Senate chamber.
We've been in contact with the leadership of the House and the Senate. They have not made that request.
Governor, have you
Yes,
heard
ma'am.
from other lawmakers in the state pushing a stay-at-home order or requesting that, or what kind of feedback have you heard from them about a stay-at-home order?
We get feedback from every quarter, people all over the state, on both sides of that one question, on both sides of just about everything that we've done, and I expect that will continue. But what we're doing as a team, and you've met many of the professionals representing the very highly competent and reliable team we have in South Carolina, we are relying on the information, advice, the science, the data to see that we do the precisely correct thing for South Carolina. And I say again, nothing is off the table. There are numerous orders that could be issued. There are many steps that could be taken. Some would have, we have yet to know what they may be depending on the development of this disease. But we are alert and we are informed and we are working as a team according to our very deliberate plan to keep the people of South Carolina safe. And we'll do whatever it takes to do that.
Governor, what are the pros then to not issuing a stay-at-home order at this time?
I beg your pardon?
What are the positive reasons as to why you are not issuing a stay-at-home order at this time?
Well, we like to base it on the advice of the professionals and the result of the orders that we have issued. When we have found non-compliance, for example, on the sandbars and the beaches, we issued an order there. When we found evidence of not compliance in the advice that we'd offered about gatherings, we noticed the availability of the law enforcement. It's been on the books for many years. It was activated, and we urged the public to take note of that. And when some didn't, then I directed the law enforcement to enforce that. So we're taking the steps that we believe are necessary at the time that it's necessary to take them, that it's proper to take them. Yes, sir.
Governor, 5 prison guards have tested positive for COVID-19.
I'm sorry.
5 prison guards have tested positive for COVID-19. The parole board has stopped doing hearings. Are you concerned about the spread of the virus in prisons, and is there any thought of maybe trying to reduce the population in a prison where it can be?
We are concerned about the spread of this virus everywhere. It doesn't matter. We don't want it to spread. We don't want one more life lost. That is our goal, to protect the people, no matter where they are, what their status is, or where they live, or what they're doing. That's why we are taking a very careful, studied, deliberate approach to do the right things at the right time in our state.
Governor?
Yes,
so
sir.
you're saying you're listening to the advice of your health professionals. So no one has told you on your team right now to issue a shelter-in-place order, as you know it?
We discuss all the options that are on the table. We discuss the level of compliance with orders, the effectiveness of the orders, or what would work better, what are the best practices. We've looked at some other states to get ideas from them and have adopted some of them. But again, we are following the advice of the professionals. We are taking a very deliberate approach to see that we do the right thing at the right time to protect the people of this state.
Governor,
One more.
Why is there a hesitation to issue a shelter-in-place at this point?
We have asked people to stay home since the beginning of this. We've had it on the highways, on the electric signals that they have on the highways. We've had an emergency broadcast on your telephone and everyone else's a few days ago at 6:30 saying, please stay home. And I urge people again, please stay home. You never know how you might contract this virus. We know that if we do social distancing, if we follow the hygiene that has been explained over and over by the professionals, that is the best way to control this. So we have urged the people to stay home. But again, when and if it becomes time to make any order that has not been made, that may not have even been thought of yet, depending on the course of this virus, we will make that order. But until then, we urge people to follow the advice of the professionals. Stay home, be careful, keep that social distance, use the hygiene, and try to look at your neighbors. If you see someone that's having trouble, if you see older people who need something, any way you can help without endangering yourself, please alert the authorities if you can. Yes, sir.
Yeah, for Dr. Bell, just what are the models saying right now about how many cases we can end up seeing in South Carolina and maybe amount of deaths too? What are the projections to date right now?
We are working with different groups in collaboration with staff from DHEC, the USC School of Public Health, and the Hospital Association to work on projections from a variety of models. One of the initial models that we use to make projections, if I remember your question, is the total
cases and projected deaths.
So I don't have that in front of me, but the projected number of positive cases going out to the beginning of May, this is an estimate, and we can provide details, is about 8,500 cases in the beginning of May, using one particular model. However, we are working on additional models that have that are based on death rates and offer different projections. They are in many ways in line with each other.
And do those estimates that you speak of account for just the amount of tests you'll be able to conduct, or along with like the zip codes, potential positives that you won't be able to test just because of the backlog or just people maybe not exhibiting symptoms and they're asymptomatic?
So there are different models. Some of them are based on the number of cases reported. Some of them are based on the expected fatality rate. And therefore, if we have a certain percentage of people who are unfortunately expected to die if infected, then we can estimate the total number of cases based on a death rate. We are making those calculations based on different mortality rates so that we have a low and a high range. So there are a variety of models based on testing, based on what's been seen in other countries, the proportion of people who are ill, and estimates of people who are in a population and who are not tested.
Thank you very much.